Medical office laboratory assistant. You want to make sure that you follow these steps every single visit. Number one, you want to view the OSHA, BSI, and infection control video. BSI stands for Body Substance Isolation. Please make sure you review the CLIA certification video. They are the ones who stipulate which procedures your lab is allowed to perform and how many times you can perform them per year. A copy of the CLIA certification should be listed and posted on the wall at your lab. Number three, retrieve the medical record. You want to review the patient's medication allergies, and you should have the following forms in the chart. The encounter form should be on front of the chart for easy access for the physician. If the physician wants to indicate a procedure to be performed, they will mark it on the encounter form. If the physician failed to mark the procedures he'd like for you to perform, just make sure you request that the doctor check it for you. Medication sheet and the SOAP note. Number four, have your equipment set up and already prepared before you call the patient back. Number five, call your patient to the lab area. Number six, you want to quickly review the patient's information with the patient. You want to make sure that any allergies the patient may have, such as medication allergies or latex allergies, you need to know in case you're going to be drawing blood or doing a urinalysis. Because the patient has a latex allergy, you cannot touch the patient with your gloves unless they are latex free. Also, the tourniquet used for phlebotomy, they do make latex-free tourniquets. Number seven, perform the laboratory procedures marked on the encounter form, and then you document the procedures on the SOAP note. And we'll see an example later. Number eight, escort the patient back to the exam room and then tell the physician that you are finished. Medical record. You want to review the patient's medication allergies. The patient is allergic to terramycin, so please do not give any injection of terramycin to the patient. Review the physician's order. The physician is supposed to indicate all laboratory procedures that they would like to perform. Each procedure must be written on the SOAP note, as you can see below under the A section. You can perform the procedure without the written order. However, remember that medical records are legal documents. If a regulatory agency or an insurance company audits the chart, the order must be in the chart. For the purpose of this exercise, the physician ordered a urinalysis without microscopy, which is a dipstick, an EKG, a CBC, which is a complete blood count, and a blood glucose test. At the bottom of the page, it spells out subjective. Remember, that's where the patient has indicated why they are there for the visit today. Objective begins with vital signs, and then the physician's exam. A is assessment, that's the diagnosis. Also under the A in this section, the doctor has indicated procedures to perform. Plan is the treatment, and the doctor is going to wait to get the results back from the labs that he ordered.